Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be going over new nurse anxiety. The goal of this video is to help you nursing students who maybe are in your last semester of nursing school or new nurse graduates who are fixing to start a job. And I want to inform you about anxiety that you may experience and let you know that is absolutely normal. So what I want to do is I want to go over what anxiety is, what you may experience, give you what may cause anxiety so you will be prepared for it and you won't be discouraged, and give you some tips on how to deal with it. Because in nursing school, this isn't really covered and you're sort of just thrust out in there and you start to experience some things you maybe didn't expect and it causes you anxiety. And you may start questioning, is nursing really for me? Did I make a mistake? So here I just want to encourage you out there and show you that it is normal. So let's talk about what is anxiety. Okay, well, anxiety is a feeling of unease, worry, or nervousness. And the signs and symptoms of it that you may be experiencing anxiety is you may experience knots in your stomach. You may question yourself constantly, be asking yourself, should I be doing this? Should I not? Oh no, how about this happens? So you're constantly questioning your ability to provide care. You may be sweaty or have constant worry. Now, let me tell you, almost all new nurses experience anxiety during the first 6 months to a year of being a nurse. Happened to me. It's happened with everyone I have precepted. It's happened with nurses I've known. This is so normal. And it's especially, the anxiety is really going to peak probably right whenever you start your job because you're brand new, and when your orientation period is over and you're on your own. So that's when it's going to peak. However, there's great news. The anxiety is going to start to decrease after about 1 year. Whenever you get your experience, get your job down pat, you're going to notice that when you reflect back that you are not as anxious and have as much anxiety as you do currently than what you did whenever you first started. So it does go away, I promise. Now, anxiety is so common that it's almost abnormal not to experience it at some point of being a new nurse. So it's just so normal, so know that you're going to experience it. Now, what are some causes that may cause anxiety? The main cause of why new nurses experience anxiety, this is from my experience and just watching others, is the following. You are thrust into this new environment that you've never been in before. Usually you maybe experienced a little bit during clinicals, and you're going to be with these new people, new nurses, nursing assistants, doctors that you really don't know very well. You're the new kid in town, and you're going to be required to learn new systems, and just probably learning from clinicals, you know that there's a computer system for everything. To get a patient transferred to a testing facility within the hospital, to going home, to charting, to entering orders, there's a system for everything and you have to know how to use it. And there's protocols, you have to learn all the protocols for medications, for how to do this, how to do that. And on top of that, you have to provide care to really sick patients that depend on you and your nursing knowledge. So you feel very overwhelmed because you're new. You don't have all that experience compared to a nurse who's worked there 5 years. So you don't feel confident in your skills and you don't feel confident in your experience. So all that conglomerated together, you feel a lot of anxiety. And some other causes is, again, just not feeling confident in your skills as a new nurse. Because in clinicals, you use certain skills, but maybe you didn't get to practice those as much because the situation didn't arise in clinicals. And you'll feel really anxious, especially whenever you're on your own, having to do some skills that you're not familiar with. So whenever that happens, just always ask for help. People are more than willing to help you out. Next, communicating with other members of the healthcare team, especially physicians. Precepting new nurses, that is the biggest thing where they have issues. It's not that they're scared to talk to them, it's that they don't know what to ask and they don't want to feel stupid, they don't want to feel dumb because they don't have that experience of knowing when they should ask for something, like for instance, how to question an order. They know that something just doesn't seem right, so how do they go about the proper way of questioning it? Or when to question an order, again, just the lack of experience. asking for something. They know that a patient needs this, but they're not totally sure if they need this. So that causes a little bit of anxiety. And when's the best time to ask for help? When's the best time to notify the doctor, and who to ask for help, those resources. Another thing is dealing with those code blue and rapid response situations. If you are going to be working in an area that doesn't have a lot of code blue rapid response, maybe every 6 months there's something like that on your unit compared to if you're working in intensive care, which happens a lot, you will have anxiety. And I have seen seasoned nurses who don't have a lot of code blues or rapid responses. They experience anxiety during these situations because it's a stressful situation for everyone involved. You have the lack of experience knowing what to do, remembering those skills from ACLS, CPR, and just the unknown. So that will cause you anxiety. Another thing is, this should go up with the first point I made, is causing harm to a patient. This is a huge one. Just feeling, that's again just back to the lack of experience, not you're hoping that if you give this medication it's not going to cause harm, or you're questioning yourself a lot, wondering, am I going to do this and it's going to hurt the patient? Because again, you just don't have the lack of experience in dealing with those situations. And next, dealing with chaos, having to juggle everything that's going on at working as that new nurse. Like balancing your patient load depending on how many patients you have, juggling those patients along with doing admissions and discharges, keeping all your paperwork up to date, looking at physicians' orders that are popping in, completing those orders, and having to deal with difficult patients in those difficult situations that don't happen normally. So dealing with the chaos can cause anxiety. And then last but not least, feeling that you're part of the team. As a new nurse, sometimes you may feel like you're a burden to the other nurses because you're constantly asking them questions or needing help, and you're trying to prove to everyone else that you're a good nurse, that you're competent, and that you can do this. And also just trying to keep up with the pace of things. Now let's look at the tips on how to deal with that anxiety that you're going to be experiencing as a new nurse, because this will help you cope with it and prevent you from becoming burnt out and possibly leaving the profession altogether. So tip number 1, take advantage of your orientation period. So important, because whenever you're working with your preceptor at the beginning, you guys chances are you'll be working side by side, and they'll be showing you the ropes, how the routine works, and how they do everything. But you need to be looking ahead. When are you going to be out on your own? And about 3 weeks before you're out on your own, what you need to be doing is taking the whole patient load all by yourself, and your preceptor is just there as a guide for you, someone that you just ask questions to. It's almost like they're just that phone a friend that you just call and ask, or if you need assistance, because this is going to help you learn how to deal with those difficult situations, how to juggle that patient load, and how to deal with that anxiety that peaks whenever you're going to be on your own. Because remember, at the beginning, when you first start your job is when all that anxiety comes. Then you'll start to feel okay because you're with your preceptor, but then when you're on your own, the anxiety is going to go off again. So that's going to help you deal with it if you take proper advantage of your orientation period. Next, ask for help. This is something you will be doing your whole nursing career, always asking for help. But as a new nurse, it's very important because you don't want to get in situations where you make a mistake because you should have asked for help, but you didn't want to ask for help because you felt like you would look dumb or something. So if you don't know the answer to something, you're not sure if you're doing this skill right, or you just need some advice, always ask a fellow nurse to help you. Another thing is to find a mentor, someone that you can talk to about your struggles. Don't go home and bottle all this anxiety in and not talk to anyone about it. Maybe you can talk to someone on the unit that you work with, another nurse that you became friends with, just someone that can understand you. So you can talk about your frustrations, talk about how you feel incompetent, get some advice from them on how you can be better. And it just really helps, and you can blow off some steam, and you can see that they experience the same thing as a new nurse, and what you're going through is normal, and it makes things better. So find that mentor, someone you can talk to. Another thing is to give it time. Anxiety, it just takes a while for it to decrease, and over time you're going to feel better. And as I pointed out at the beginning, after 6 months to about a year, you're going to have less anxiety. You're going to start feeling more confident, and you're going to start being more familiar with the job because nursing has a routine to it. Yes, you have those chaotic situations that come in, that arise, but if you can have your routine and everything down pat, you can deal with those a lot better. And don't beat yourself up when you mess up, because it's going to happen. You're human, we mess up. What you need to do is pick yourself back up, review what happened and how you can correct it, because the experience is the best teacher, but so are mistakes. And when you make a mistake, you mess up, chances are you're going to remember it when that situation arises again, and you're not going to mess up because you have that experience. And then last but not least, one of the other important things is balance your life. You need to have a work life, but you need to have a personal life, because if it's all work and no play, you're going to get burnt out with life, especially your nursing career, because nursing is stressful and you need that outlet to be able to relax. So at first, to prevent yourself from getting totally burnt out, until you start feeling less anxious and more confident in your skills, don't pick up those extra shifts for money, because if you start overworking yourself, you're not giving yourself time to rest, to have days off, to eat good, to exercise, which all three play a huge role in how you deal with stress and anxiety, then you're going to get burnt out. You're going to start hating your job and you're not going to like it. So until you start knowing how to deal with your anxiety and become confident in your skills, don't overwork yourself, because remember, you are not a machine, you are human, and our patients depend on us to be alert, to be in the best shape we can so we can provide the best care to them. So that is about how to deal with new nurse anxiety. So be sure to check out my other videos on new nurse tips, and don't forget to subscribe to this YouTube channel, and thank you so much for watching.